Hi, my name is Olivia Snyder. I work at Filler Massages, and today I am going to demonstrate some self-care massage techniques that you can use to treat the symptoms of temporomandibular joint dysfunction, or more easily put, TMJD. Okay, so we're going to start by placing our hands on either side of our face, and we're just going to gently clench our jaw there. Okay, so when you do that, you're actually going to feel the temporalis muscle and the masseter muscle contract when you clench your jaw. These are the two muscles, the two main muscles used in biting, chewing, clenching, grinding. Okay, so they're the muscles that we're going to be treating today. So next we're going to place our fingertips on our cheekbones. So just feeling for the ridge of the cheekbone there. We're going to come all the way down in front of the ears, follow the jaw down all the way to the chin. Alright. Okay, so once we're at the chin, we're actually going to do a little bit of cross fiber on the suprahyoid muscles, which are all under the chin here. They're called suprahyoid because they're actually above the hyoid bone in the throat. Okay, so just some cross fiber on there, fast movements across the muscle fibers. Alright, and you can actually feel that contract if you place your fingertips on the muscles and swallow. You'll feel the suprahyoids contract. Okay. So now we're going to do a little bit of work on the masseter muscle, which is the one here on the lower jaw. Okay, so we're going to bring our fingertips back along the bottom of the jaw. And what we're going to do now is just feel around for any trigger points that we might have going on, trigger points or knots that we might have going on in this muscle here. Now this is actually the strongest muscle in the body relative to its size, so it is prone to developing some tension. Okay, so a trigger point is going to feel like a tight mass of muscle, and as you work it, you'll feel a little bit of tenderness there. So we can just do some compression on those spots. That's it. Okay. Really work those muscles out. Okay, so from here, we're going to do some lengthening strokes on the masseter. Okay, so this can be done one of two ways. I'll start by placing my fingers on the jaw. I'm going to very slowly open my mouth and I'm going to drag my fingers up to the cheekbones. Okay, so like so. Okay, so once I've done that, I'm going to do the same thing again in the opposite direction. So starting on the cheekbones, slowly opening the mouth and dragging my fingers down to the jaw. Alright, so there were the lengthening strokes on the masseter. The last technique that we will do on the masseter muscle is a compression technique. So we're going to come back to the cheekbones. I just want you to feel along for a little groove in there, and that's actually the attachment point of the masseter. So as you can imagine, a lot of tension builds up there. So we're either going to take two fingers or our thumbs, and we're going to push into that groove, and we're going to go in and up. Okay, so really stretching out that attachment point. Okay, if you hold that for about 15 seconds, you should feel the muscle release underneath your touch. Okay, so after we finish with the masseter, we're going to move up to the temporalis. Okay, so the temporalis is about an inch above the ear, right up here, right by the temples. So we'll just place our fingers on there, and we're just going to do some really slow circles. All the way around. So your fingers aren't actually moving over the hair and the skin, you're actually taking the skin with you. Alright, similar to the lengthening stroke that we did on the masseter, we can do the same thing on the temporalis. So we start right here on the jaw, on the hairline, I'm sorry, and open the jaw and push back. Do that again. And any trigger points that you may have in there, you should feel move under your touch. Okay, now we're going to come down to the joint itself. So the temporomandibular joint is right here in front of the ear, and as you work it, you'll feel a little bit of tenderness there if you have any troubles, any TMJ troubles. Okay, so you can come along, compressions. I'm actually starting by the ear and pushing outwards towards my face this way. Okay. You can also open and close the jaw as you apply pressure. Okay, so we're going to finish the routine with just some simple ear pulls. Okay, so we're just going to pull on the ears there, do both at the same time. And this is basically just going to give some light stretching to the temporalis muscle. Okay, alright, and there you have it. So thank you for watching, and please visit our website at www.filamassages.com for more self-care techniques, videos and articles. Thank you.